Hello, I'm Holly Crawford, Director of the County of San Diego Office of Emergency Services. An important goal of our office is to provide the leadership and necessary training to promote a healthy and positive environment at our evacuation shelters. In an emergency situation, tensions can run high, and people who need additional assistance can feel a heightened sense of stress once their routine is altered. This is the third of 3 training videos designed to present shelter workers with best practices and proper procedures when caring for individuals who need additional assistance. This video will focus on people with emotional disabilities, and much like our video on how to work with people with cognitive and physical disabilities, you will learn how to effectively respond to a variety of situations. It is this knowledge that will give you the confidence to safely react and respond to situations that involve people who need additional assistance. These skills will ultimately be beneficial to all shelter residents.
The County of San Diego Office of Emergency Services works with employees from the 18 cities within San Diego County, along with several local agencies, to provide shelter when needed. The American Red Cross is one of the lead agencies. The American Red Cross's mission is to prevent and alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and the generosity of donors. Each year, the Red Cross responds to nearly 70,000 natural and man-made disasters in the U.S., ranging from fires to hurricanes, floods, earthquakes, tornadoes, hazardous material spills, transportation accidents, and explosions. They provide food and shelter in emergencies, assist members of our armed forces and their families, as well as teach life-saving skills, and more. Volunteers are at the heart of the American Red Cross and a huge part of its success. People from local communities are relied upon to help carry out humanitarian work. Local volunteers make up 95% of the workforce that makes it possible for the Red Cross to respond to disasters and save lives.
In an emergency, there's no way to predict who will arrive at a shelter, the precise nature of their needs, or the challenges the shelter staff may face. This training video is meant to raise awareness and address some of the needs and considerations important to assisting shelter residents with emotional disabilities. It's a starting point.
A disaster has occurred. Shelters are opening to assist people who have suddenly become displaced. Your job is to greet them, to welcome them, and as quickly as possible to make them feel comfortable, assess their needs, and direct them to the appropriate people and services at the shelter or elsewhere if necessary. It may surprise you to know how common mental illness is. Every year, it's estimated that 1 in 4 American adults suffer from a diagnosable mental illness, ranging from mild to severe. So as a shelter worker, you will most likely meet and help people who have mental health challenges and needs. It's important that you know at least some basic information about mental illness, behavioral disorders, and emotional disturbances, so you can respond appropriately and best help those who need your assistance. And it's important to note that people with emotional disabilities can also have other disabilities. Mental illnesses are medical conditions that can alter and interfere with a person's ability to think, feel, relate to, and communicate with others. In some cases, mental illness may interfere with a person's ability to function on a daily basis. Mental illness can range from mild and manageable to chronic and severe. The illness may be simple to treat or quite complex and persistent. Behavioral disorders and emotional disturbances are more specific aspects of mental health and illness. They are conditions marked by one or more characteristics that persist or recur over a long period of time and adversely affect a person's ability to live and work. The modules you will learn in this video specific to people with emotional disabilities are Types of emotional behaviors and disorders. Registration and intake. How to handle aggressive behavior. Anxiety and panic attacks. Extreme situations, such as schizophrenia and hallucinating, and behaviors related to substance abuse and withdrawal. So what exactly are we talking about? What are the types of emotional behaviors and disorders that you are likely to confront as a shelter worker? They may include mood disorders, such as major depression and bipolar disorder, schizophrenia, anxiety disorders, such as panic attacks, obsessive-compulsive disorder, post-traumatic stress, and various phobias, attention deficit hyperactivity disorder, more commonly known as ADHD, and behaviors related to substance abuse and withdrawal. As a shelter worker, one of your challenges is that mental illness is not always obvious. Symptoms may come and go. They may be kept under control with medications that, in a disaster, might suddenly be unavailable or forgotten. Behavioral disorders or emotional disturbances might be triggered by the stress and confusion of an emergency and its aftermath. While there is no single, simple checklist for identifying people who have mental illness or who may be subject to behavioral disorders or emotional disturbances, there are a few indicators to keep in mind as you begin the process of registration. You may notice there is an inability to learn or comprehend, which cannot be explained by factors such as health or sensory disabilities. Inability to establish relationships. Under normal conditions, inappropriate actions, thoughts, and language are exhibited. One or more of the following behaviors is displayed, often repeatedly and usually without reasonable justification: hyperactivity and impulsiveness, inattention or withdrawal, aggression, whether toward others or in the form of self-injury, and depression. Let's begin with those first moments when an evacuee arrives at a shelter. You're there to help, but in those first anxious moments, it may not be clear to you or to the evacuee what help is needed and how best to proceed. Just remember to treat everyone equally and with respect. Treat everyone as you hope they would treat you. Every newcomer to a shelter must be registered. That's critical for many reasons. Shelter workers need to know who people are. They need to know how many people are in the shelter to make sure there are adequate supplies and meals. Registration is the first opportunity shelter workers have to evaluate incoming residents. There is an English and Spanish registration form. Our community is diverse, and some shelter residents may not speak English. You may need to look for someone who is bilingual to assist you in a language you don't speak. If needed, you may also request a translator through the shelter manager, who will contact the Care and Shelter Branch Coordinator from the Emergency Operations Center. Keep in mind that there may be a slight delay in the arrival of a translator. Make every effort to appropriately communicate with everyone. It's important for the shelter resident to understand your questions. The next step is to make your initial observation using the registration intake form. The questions on the form will help you to identify and obtain needed information and supplies for shelter residents. Through your observations, you'll need to determine if the evacuee or a family member appears to be in need of immediate medical attention, appears too overwhelmed or agitated to complete the registration, or they appear to be a threat to themselves or others. If the answer is yes, stop the registration process. Then immediately notify a medical services staff member or a mental health worker on site. If the situation is critical or the situation requires support, you should immediately contact the shelter manager. Your shelter manager is there to support you and address your concerns. Remember, the shelter manager will have a lot of situations to handle, and you can help by properly evaluating and prioritizing your needs before you contact him or her. If the situation is critical or requires support that is not available, call 911. Only call 911 when the condition is life-threatening. And if possible, notify the shelter manager that you plan to call 911. If that is not possible, make sure you notify the shelter manager immediately after the call is made.
Are you okay?
Who are you?
My name is Deja. I work here in a shelter service.
Who are you?
Yes,
Who are you?
I'm here to help you. I just need some information from you. Help me to fill out these forms. And are you okay?
Who are you?
Yes,
During registration, there will be items to consider when assisting someone who may be mentally ill. First of all, remember that you may not be able to discern right away if a person is mentally ill or experiencing some sort of mental health issue. Often the signs are subtle or collective, a combination of several clues.
Who are you?
Sometimes the first recognizable signals are unusual behavior. It might be physical, might be verbal. Whatever it is, it doesn't seem to make sense in the context of the moment. If you suspect a mental health issue, politely ask in a non-judgmental tone if there are any issues that you and the other shelter staff need to be aware of.
like I said, my name is Deja. Any medical issues that I should be aware of?
Emphasize that you're asking in case there's something you can do to help. Do they require or take medications? Do they have those medications with them, or a list of what is needed? Be aware that no matter how much you inquire, the person may not tell you. In such cases, proceed with care. Speak slowly and in a low, calming voice. Don't talk down to the person or raise your voice. Don't interrupt, but if the conversation becomes endless or rambling, let the person know that you need to move on to get them help more quickly. Keep your conversation and instructions simple, clear, and brief. Don't give multiple instructions. Ask or state one thing at a time. Lean forward with your body. It shows interest and concern. If a person becomes confused, slow down and repeat as necessary. Be empathetic and reassuring. Let them know you're there to help. If a person becomes agitated, stop the process. Help them find a quiet corner to gather themselves.
I just need help. I believe he's a little
Hi,
agitated.
what can we do for you?
Yeah, can you help me?
No. Who are you?
Yeah.
And who are you?
Yeah, we're gonna help you. Okay, medical personnel, please.
If a situation appears to be developing beyond your control, step back. Don't try to resolve it by yourself. Quietly and calmly seek help from your shelter manager or medical services staff at the shelter. Every person is different. Your training manual contains a more comprehensive look at the registration process and how you can best do your job in these first moments. Ask the shelter manager if you're unsure about your assessment. A person with one disability may have other disabilities, or they may not. Be carefully observant and considerate. Be smart. Be proactive. Be respectful. It's important to understand that if at any time the situation exceeds your level of training and comfort, seek assistance from your shelter manager or the medical services staff at the shelter.
The best way to interact with people who have been traumatized by disaster, whether you have a mental illness or not, I think is remembering really key common sense behaviors. You know, always welcoming, always how can I assist you and how can I help you? Is there anything that I can bring to you? What is going to make you feel more comfortable? And I think that those are common sense ways of dealing with anyone. It's not different with individuals that may have a mental illness. And I think it's keeping those things in mind that are going to make things easier for the shelter personnel and the people that are staying there.
Staffing for disaster shelters typically includes crisis counselors. These mental health workers are either licensed or certified mental health professionals. They are there to educate other shelter staff and provide assistance as needed. Shelter staff should never try to diagnose a mental illness or assume an individual has a mental illness or substance abuse condition. If one is suspected, the mental health staff should be called in to assist. If you suspect that someone has emotional issues that need attention, your shelter manager can contact the Emergency Operations Center. If a mental health professional is not immediately available, seek medical assistance. If a person becomes violent, request your shelter manager and call 911. It's also important to note that the overwhelming majority of individuals living with a mental illness will not demonstrate violence. If you suspect mental illness, ask the shelter resident if they have family or friends who can assist them during their stay at the shelter.
I do feel people treat me differently in many different ways because of the depression. My parents didn't believe that I had it for quite a while. I normally would have my episodes of going into the depression and being in it for quite a while until I could either pull myself out of it or medication is needed and hospitalization. The normal personality I have is somebody that's very talkative and very outgoing. When I'm going into an episode, it would be being very quiet. Isolating is definitely one where I totally am definitely in an episode to where I don't want to talk to anybody or I don't want to see anybody. I just want to be left alone. One worry, if I had to go to a disaster shelter now, one would definitely be my medication. I would definitely make sure I had enough. If not, somehow talk to the workers to see how I can go about getting more. If a shelter worker saw me going into an episode, I would appreciate them coming over and asking if I needed any assistance, to see if I could talk to somebody or see if there's a medical doctor or anything, or even a psychiatrist maybe in the building to where I can talk to an actual trained therapist. Words of advice I'd give to shelter workers would be to definitely treat everybody as you would want them to treat you, is the main thing that I try to strive for. Definitely have a lot of patience, be kind and generous, really to ask the people. You know, they can go up to them and say, hey, I see you're starting to get depressed or you're being quiet. Would you like somebody to talk to? I'm just the same as everybody else. I just have an additional problem that causes me to get depressed. My chemical imbalance is not all correct. I want to be able to be treated definitely with respect and caring.
The manifestations of mental illness are numerous and diverse, from quiet and withdrawn to agitated and yelling. It's not your job to resolve or cure whatever ails the person. Your task is to help them get the help they need within the context and resources of the shelter and the Emergency Operations Center. Often that means simply connecting the person with a mental health or medical professional as quickly and discreetly as possible. Sometimes it means addressing factors that may be triggering a mental health crisis or exacerbating it.
Give it back! It's mine now! Stop! It's mine!
For example, if a person appears confused, anxious, or agitated by the surrounding commotion of a working shelter, try to move them to a quiet, calm place.
God, what the hell, dude?
If a person is angry, respond calmly. If there are obvious causes of the anger that can be addressed, do so, such as shifting the conversation and attention to another more benign topic, or asking a colleague to take over if the person is angry with you. Remember, an angry person isn't really mad at you, but rather grappling with the aspects of his or her condition. Don't take it personally. To some degree, being in a shelter is always stressful. After all, nobody wants to be there. Shelter residents have been impacted by a natural or man-made disaster, which is a major disruption to their routine and sense of normalcy. As a result of this stress, tensions can sometimes rise and lead to negative behaviors. The behaviors may quickly subside or they may persist. If the behavior turns aggressive, it's time to involve the shelter manager and a mental health professional.
I understand your frustration.
Oh, really? Do you? Do you, Teresa?
Yes.
Do you understand?
I do understand.
You know what? I've been up the road 5 times to try and get to my house, and they will not let me up there. I got dogs locked in. I don't know where my wife is.
It's for your
I don't know what's.
safety.
Oh, is it really?
Anger can have many root causes and derive from many situations. A person might be coming down from an addiction like heroin, cocaine, or other drugs. Or they may have autism or an intellectual disability, such as dementia, that causes them to become easily frustrated. In a shelter setting, even the average person may be overwhelmed or scared. To handle anger and frustration before it gets out of control, first and foremost, stay calm and do whatever you can to avoid confrontation or escalate an already worrisome situation. Don't show fear, alarm, or anxiety because it could increase the person's agitation and make the situation worse. If you feel at risk or threatened, seek immediate help from the shelter manager. Try to assess the situation from all points of view. It's best to understand as much as you can before you attempt to change or alleviate the problem. Give space and time to the person who is behaving aggressively to vent their anger or objections.
Half of it.
No,
Okay,
I
I've been up my street 4 or 5 times trying to get up there, and they blocked it off. I need to get inside my house. I got my dogs locked into my house. I need to get into my house, and I don't know where my wife is.
Consider the situation from their point of view. Do they have legitimate reasons to be upset? Encourage them to talk.
It's no magic, but if you put somebody who's been traumatized to this whole red tape, that you have to sign this paper and that paper and the other paper, of course he's going to lose his temper, and he's going to scare people. So this individual walks in and yells at the top of his lungs, "I need some help!" And there's hundreds of people moving in. This is in LA with the Mexicans and the Koreans and all fighting after the Rodney King incident. People freeze. The shelter personnel freeze. They don't know what to do. And so basically I see him, and he was in the middle, and I go towards him, pick up a bottle of water, and I said, "I can help you. What is it that you need? Come with me." And that's all it took.
But you don't even know the half of it.
No,
Okay?
It's using your instinct, your common sense, your intuition, your humanity, really, as simple as that, to prevent something from really getting out of control. And not being scared, that is, what is it that this individual needs, and making it happen.
Consider the situation from their point of view. Do they have legitimate reasons to be upset? Encourage them to talk. Maintain eye contact, but don't get too close. Give them space. Don't take the behavior personally, even if some of the comments are hurtful, unfair, untrue, and directed at you. The person most likely is simply trying to communicate a need, not attacking you on a personal level. If you find the real cause of the behavior, you can address it and possibly prevent future incidents. Be patient. Don't rush the process. Don't express frustration or anger. If you begin to feel either, step back, take a deep breath, and find extra help and support if necessary. If the person's anger persists, try to distract their attention. Ask questions. Suggest remedies. Try to change the dynamics of the conversation. If the person's behavior threatens to become physically violent, give them plenty of space, make sure others are not at risk, and seek help from the shelter manager and a mental health professional. After the incident, when things have settled down, don't punish the person for their behavior. Try to carry on as normally as possible. Be reassuring and compassionate. Focus on the person, not the behavior. The person who behaved badly may completely forget what happened.
My name is Philip Scheckler. I'm a Vietnam vet who suffers from post-traumatic stress syndrome, and my service dog, Randy. In the event of an emergency, we had to go. This dog is critical. He is used to keep my stress level down, reduce my anger. If anyone's around, hopefully they will contact me and say, what is the purpose of the dog? I will explain the purpose and the function of the dog to them. But he's critical to me in any high stress situation. That's why the dog is with me, is to prevent trauma. If anybody sees a service dog, if that person of authority, there's only two questions the law allows you to ask. What is the function of the dog? I go, it is a service dog. Then the other question they can ask, what functions does it do? And I can explain that. They're not allowed by law to ask the nature of my disability. I can tell them, but they can't ask it. People always ask me what Randy does. The major things he does is in crowd or in the public. The first thing he does, I will give him a slight nudge of the leash, and the behavior is called block, where he gently gets in front of me. If somebody still keeps coming, he will give a growl, and I've never had it past the growl to keep away. The other major function he does is called cover. When I'm looking at something away, I'm focused to the front, he will look and he will cover my back. That's his major two functions, is just to keep people away from both my front and my back and getting too close to me. If for any circumstances I had to go to shelter, all I'd really ask for and require is just a little space and a little consideration for my service dog, which would be no more than a little place to bed him down, not too close to somebody, water, and access to food. That's all we ask for. If anybody asks me of any advice that you would do when you saw a service dog, there's many service dogs. Some are for physical disabilities, some are for mental disabilities. In my case, the mental disability of post-traumatic stress, you can't tell it, you'd never know I got it. The major indicator, the only indicator that I have, is my dog. All one should do, if you see one of these animals, is gently walk up to the owner and ask if there's anything you can do. The dog is a clear indication that there's either physical disability or a mental disability, and any worker should just ask if there's any special accommodations. That's all any of us ever ask for.
High anxiety can happen to anyone. Triggers vary, but major causes of anxiety include strong feelings of confusion, disorientation, and isolation. These feelings can stem from cognitive disabilities, and they can also be caused by emotional disturbances and mental illness. For example, being anxious can come from schizophrenia or bipolar disorder, among other conditions. How do you know someone is suffering from severe anxiety? The physical symptoms are not always obvious, and they vary from person to person. They may include nausea, shaking, and sweating, but also harder to detect, heart palpitations and shortness of breath. Anxiety attacks usually occur suddenly and without warning. They usually peak within 10 minutes, and they rarely last more than 30 minutes. But during that short time, the terror can be so severe that the individual may feel as though they're about to die or totally lose control. The physical symptoms of anxiety attacks can be so frightening that many people believe they're having a heart attack. It's difficult to determine just by looking at a person if they're just feeling sick or if it's something more serious. So it's critical to ask someone who you believe is having a panic or anxiety attack about what they're feeling.
I can't stop shaking.
Okay, you having a difficult time breathing?
I think I'm having a panic attack. I can't stop shaking.
Okay, all right.
I can't breathe.
Okay.
I can't breathe.
Okay, well, let's breathe then. I get those. I get panic attacks, and I know they're scary.
Typically, someone will say they are feeling overwhelmed, frightened, and unable to cope with the situation or their response to it. They may feel like their actual physical well-being is at risk. There are a number of ways that you can respond and help. First, try to understand what the person is experiencing. so that you can better help them get through it. Stay with the person and keep calm. Move them to a quiet place when possible. Don't make the assumption about what they need. Ask them. They may or may not have had a panic attack before. Speak to the person in short, simple sentences. Help them focus by asking them to repeat a simple task, such as raising their arms over their head. Listen to what they are saying. Don't argue with them or dismiss their points as unimportant or irrelevant. Let them know you care. Empathy will get them to a better place faster. Help slow the person's breathing by asking them to join you in a breathing exercise, which may slow their heart rate and calm their body response. If the person seems reluctant, tell them that it will help you too. Have them place their hand on their stomach. Instruct them to breathe from their belly, watching their hand go in and out with each inhalation and exhalation. Ask them to count slowly to 4 as they breathe in, and then another 4 count as they breathe out. It's helpful when a person is experiencing anxiety to say things like, "You can get through this. Good job. Tell me what you need now. Concentrate on your breathing. Stay in the present. Maybe it's not the place that's bothering you. Maybe it's the thought. I know you're feeling scared, but you're safe here." Remember, don't rush things. Take your time to help the resident and let them take their time to feel the anxiety fall away. You'll be able to identify when an anxiety attack is over because the individual will appear and act calm, and they will be able to communicate to you that it has passed and they feel better. Their breathing will subside, and they'll appear physically more at ease.
Yeah, good. I know. It's scary. Oh, hi.
Hi, how are you
Hi.
doing?
Fine.
You feel better?
Yeah.
Okay. Any
We
chest
did
pains
better.
or anything going on?
No, it was like that before, but
Okay. You were having chest pains?
well, it felt like.
If it seems as though the individual's anxiety continues after going through this exercise, and the situation appears to be developing beyond your control, step back. Don't try to resolve it by yourself. Quietly and calmly seek help. In cases of severe mental illness, such as a person hallucinating or acting out in an alarming manner, immediately contact a shelter manager, seek medical help, or if necessary, call 911. Your primary job is to keep everyone safe, the person with the mental illness, yourself, and those around you at the shelter.
Okay, well, everything's gonna be okay.
Get away.
It's okay.
Get
My
away
name's
from me.
Joe. I'm here to help.
You're right.
Is it okay? I've got a much quieter space over here, so these people won't be around to bother you, okay? Is that be all right? Okay. It's right this way. Do you need any assistance?
I do.
Okay. Right over here. Is it okay if I help you through?
The most frequent hallucination involves hearing, and often includes hearing voices which tell the person to do something. You may recognize the person is suffering from auditory hallucinations when he or she appears preoccupied and unaware of their surroundings, has difficulty understanding or following conversations, and misinterprets the words and actions of others. The person may also isolate themselves or use radio or other sounds to tune out the voices. A person experiencing other types of hallucination, visual, tactile, smell, or taste, are usually identifiable by the person's interaction with the hallucination. Visual focus on something you cannot see, touching, scratching, or brushing things off themselves, sniffing or holding their nose, or spitting out food when there's no apparent reason to do so. You will probably be able to recognize if a person is having a hallucination. A person experiencing hallucinations needs treatment, and the mental health services staff at the shelter should be alerted to assist with the situation. Reassure the person that you want to help them and explain who you are, what you're doing, and why. When the shelter manager and mental health professionals arrive to assist you, explain who they are, that they are there to help, and how they're going to help. The person needs to understand what's going on in order to reduce stress and confusion, which can increase hallucinations. In cases of substance abuse, a person may be coming down from a drug or struggling in the absence of that drug. Your role is to communicate that medical assistance is available.
Oh, you don't look so good. How are you feeling?
I'm pretty bad.
You're looking pretty bad. How about let me get somebody. I'm gonna go get a nurse from the medical services to come over and look at you, okay? Because you don't look so well right now, okay?
Withdrawal is a group of symptoms that occur upon the abrupt discontinuation or decrease in intake of medications or recreational drugs. If a person is experiencing withdrawal symptoms, they have developed a physical, mental, or chemical dependency on the drug. This happens after consuming one or more substances for a certain amount of time, which is both dose-dependent and varies based upon the drug consumed. For example, prolonged use of an antidepressant will cause much different symptoms than the use of heroin. Symptoms are based on the specific drug from which the person is experiencing withdrawal. However, common symptoms may be anxiety, sweating, vomiting, diarrhea, irritability, fatigue, and shaking. To address someone who is experiencing any of the common symptoms you may see, you will have to address the specific symptom that they are experiencing at the time. If you feel you cannot handle or address the symptom, or it is beyond your comfort level or ability to assist, the best thing to do is request assistance from a medical services staff member.
My name's Teresa. I'm here to help you.
My name is Carl.
Carl? Carl? You know what, let me get a nurse so we can make sure that you're okay.
Fine.
Yeah, I need a nurse from medical services to the dormitory, please. Okay. Carl, it's okay. Carl, look at me. It's gonna be okay.
A lot of times when someone has a mental illness, it's not visible, like a physical illness, maybe. However, shelter workers may be able to observe signs like someone's increased anxiety, or if they're responding to a hallucination, they may be talking to themselves. They may be talking to something that other people aren't able to see, and really just checking in with them, asking them what they need to feel safe. Some people may have things like listening to music that helps them kind of zone in. Others may need to go for a little walk, and it doesn't have to be a walk at the beach. It can be just some private space, talking with someone. Sometimes it's holding on to a physical object, especially for children. Those may be some helpful techniques, you know, just reminding themselves to breathe and utilize the work that they've already done with their providers to help keep them calm and safe. In working with people with mental illness, patience and understanding goes a long way. Sometimes when people are stressed out, they may need to hear instructions more than once. They may not fully understand what's going on. It doesn't mean they're challenging or combative. They're just trying to feel safe in an situation that they're not familiar with. And so it's really helpful to, you know, extend that kindness, patience, just a few seconds and take the time to explain the process, and also remind the person to use their systems to feel safe as they need to. And just remember that people with mental illness are also people. They're humans, and they're someone's father, brother, mother, sister. And just because one doesn't understand mental illness fully or completely, they're still human beings. Kindness and patience go a long way. They're not to be feared. They just need to be understood.
What is universal and necessary to all shelters are the people who make them work, the professionals and staff who shoulder an enormous responsibility, the care and well-being of people in need. This video showed you some of the issues you may deal with helping people with mental illness. It touched on the diversity of conditions and types of emotional behaviors and disorders. There can be mood disorders, depression and bipolar disorder, schizophrenia and hallucinating, anxiety disorders, panic attacks, obsessive-compulsive disorder, post-traumatic stress disorder, and behaviors related to substance abuse and withdrawal. You also learned about how these disorders might manifest themselves to others. They may be unable to establish relationships with others, display inappropriate actions, thoughts, and language, or one or more of the following behaviors: hyperactivity and impulsiveness, inattention or withdrawal, and aggression toward others or in the form of self-injury. This video training program emphasized the need to be compassionate, observant, empathetic, and responsive from the moment an evacuee arrives at the shelter until he or she is able to leave and return home. It showed the importance of understanding and using shelter resources, particularly those of trained mental health professionals and medical services staff. It talked about what to do if a person is confused, angry, behaving in an alarming manner, or experiencing physical consequences of their condition.
In the event of an actual emergency, you'll need to make the best possible choices and take the most appropriate actions based upon your training, the expertise of professional shelter staff, and common sense. Working in a shelter is a powerful, rewarding experience, and I know you'll do everything you can to make every resident comfortable while supporting his or her independence. Thank you for your time and willingness to serve our community.